The federal government says at least 950,000 additional visits to the GP have been bulk billed since an incentive was upped last November. That's a 2% increase, lifting the bulk billing rate to 77%. Let's bring in the Federal Health Minister Mark Bulter from Parliament House. Minister, good morning. You must be happy with these figures.
Well, I am happy. They are the green shoots of recovery, Michael, because when we came to government, we inherited a system that saw it harder to see a GP than it ever have been, and also bulk billing in freefall. So we needed to arrest that really significant slide in bulk billing, but also see some recovery. And I'm really pleased that those additional free visits are particularly pronounced in some of the parts of the country I was most worried about. So in regional Australia, in some states like Tasmania in particular. But there's obviously more for us to see. There's only 5 months gone since we tripled the incentives, the centrepiece of our budget last year. But I'm pleased to see some recovery.
Have you got a target in mind? It's 77% at the moment. Are you aiming for higher?
I want to see it continue to go up. It's part of our really broad plan to strengthen Medicare. It's in addition to the 300,000 visits we've seen over the last several months to our new network of urgent care clinics. Every single one of those visits was also bulk billed and also taking pressure off our hospital system. You know, it's the 40th anniversary of Medicare earlier this year. Michael, we are determined to see it strong and last for another 40 years.
Can we expect further measures on this front in the budget coming up in May?
Well, we're focused right now on implementing the $6 billion investment from last year's budget. The centrepiece was to triple the bulk billing incentive, but we've been opening urgent care clinics. We're supporting general practice to put on more nurses, more practice nurses who play such a significant role in general practice as well. So we've got a lot on the go at the moment in Medicare, and obviously I'm not in a position to announce what we might be doing in the budget in a couple of weeks' time.
OK, I want to talk about health insurance. We saw the figures, inflation figures last week showing that rise in quarterly inflation in Australia, worrying sign for everybody concerned. One of the reasons cited is high insurance costs. Now, I know you recently put a limit on the scale of the increases health insurance funds could charge their customers. Are you still worried, though, that at least some health insurers are charging their customers way too much?
Well, you're right to say that in the general insurance sector, prices are going up quite significantly. I think that's a global phenomenon. But in health insurance, we were able to keep health insurance rises to an average of 3.03% for 2024. That's significantly below the inflation rate. And although, no one likes to see a significant part of their household budget go up at all, I was determined to keep that increase to as low as possible, which is why over the summer period, I went back a couple of times to the insurers and really urged them to sharpen their pencils and keep those rates, the increase to the rates as low as possible.